The Arizona Department of Health Services last week confirmed the state's first human cases of avian flu. This has been a growing issue across the country, and it's now hit Arizona. Joining us to discuss the state's response and how to mitigate the spread of avian flu is Dr. Ryan Wolker. He's Arizona's state veterinarian. Good to have you here.
Thank you very much, Ted. Pleasure to be here.
Okay, so first of all, where were these cases found?
These cases were in Pinal County, and actually the cases involved workers that were directly involved with the response efforts on this particular farm.
Okay.
So they were not the general public.
Okay, how do we know, how do you find out stuff like this? How is this discovered?
So we work, Arizona Department of Agriculture works very closely with producers and accredited veterinarians in the state. And when producers or accredited vets report to us that they're seeing, significant mortality or morbidity events of, animals dying or illness, then they report to the Department of Ag, and then we launch an investigation.
And when you launched that investigation, in this case, you found some human workers affected.
Well, we found the sick birds first.
Yeah.
And then in the course of the response efforts to that outbreak on this premises, these workers came down with some very mild clinical signs, mostly consisting of some red eyes, some conjunctivitis.
Interesting.
Yeah.
What constitutes an avian influenza outbreak?
Excellent question, Ted. And to answer that, basically when we look at influenza A viruses, particularly in avian species, they kind of fall into two categories, those being low pathogenic avian influenza viruses, which really don't cause a whole lot of clinical signs. Most of those cases are often subclinical, not detected. And then there's what we call highly pathogenic avian influenza viruses, where we see a significant amount of illness and mortality in the birds. And those are the ones that we're concerned about.
Yeah, the higher levels, obviously.
Correct.
The one how often do do we see these higher levels every year, every few years? How often?
Very good question. Every few years. So prior to this outbreak, which started in 2022, our last significant outbreak of highly pathogenic avian influenza in domestic poultry species was actually 2014-15. So we often see this pattern of going 7 to 10 years between outbreaks or detection events. We do see this virus in wild waterfowl. And we do detect that more frequently during hunter-harvest sampling, for instance.
You mentioned starting in 2022. Is that relatively a long time for one particular outbreak?
For this particular outbreak, yes. And it's behaving a little bit differently than previous outbreaks. So this one is tending to just kind of smolder on.
Does that make this more or less a threat to humans?
None of the avian influenza viruses that have been detected to date have shown any significant human adaptation. So it's still considered a low risk to the general public as per the CDC.
What about other mammals? Are you seeing increased infections there?
We have seen this virus in other mammalian species, and actually quite a wide variety of mammalian species, to include big cats and zoological collections, even some seals. But again, that may be related to proximity of wild birds, wild waterfowl, seabirds, shorebirds, next to those marine mammals.
Interesting. Correct me if I'm wrong, with the backyard poultry flock in Maricopa County, a ways back tested positive. What was that all about?
So the Maricopa County detection was actually quite recent, but our backyard poultry detections in Yavapai County in 2022 were our first detections of highly pathogenic avian influenza in quite a number of years.
So what does the public need to know when we hear like there could be wildfowl and we could hear all this? I mean, if there's a pigeon hanging around your yard and you got a dog or a cat outside, what do we need to be considerate about here?
Honestly, the general public, the risk is really low, even to pets. I guess the biggest take-home message here is if you do come across a deceased bird, don't let your pet make contact with it. If it's on your property, wear personal protective equipment, gloves, and dispose of that deceased bird as soon as possible.
And overall mitigation efforts around the state, what is being done right now?
So mitigation efforts, obviously we get called to investigate any mortality events that we get notified about. To be clear, we have not had any livestock cases, i.e. cows, in the state of Arizona to date.
I was going to ask about that because the bird flu, apparently it's still spreading through dairy cattle in other parts of the country. We have not seen that in Arizona?
We have not.
Okay, is that something that you expect maybe to see because it's so prevalent elsewhere?
I certainly hope not.
Yeah, of course.
But there is a chance. When we look at the industries, there sometimes is a lot of movement of animals across state lines, and different premises in different locations. But we've done a significant amount of testing in the state. We've probably processed somewhere in the neighborhood of 1,200 to 1,500 milk samples since the outbreak in dairy cattle was first detected back in the end of March of this year, and we have had no positive detections to date. So.
And that's interesting because we keep hearing about recall this, and the feds are recalling certain things here, there, and otherwise. But for you, the idea is don't let it get to the recall. I mean, don't let it get to the shelves. Get it before then, correct?
That is correct. And that's where, the Arizona Department of Agriculture, the Office of the State Veterinarian, we are kind of situated at that ground floor level working with the producers to ensure that those products, if we do get a disease detection, that they don't ever get onto shelves in the first place.
So last question here, bottom line, where do we stand right now in Arizona with avian flu?
So we, are currently engaged in a posture of readiness to respond to any disease events as the situation may arise. But again, just want to stress that the overall risk to the general public is very, very low, and the safety with respect to milk products, pasteurization is effective at eliminating the virus. So there's no concern there for human health.
And real quickly, is there a seasonal element to any of this, or is it?
There is.
Is it?
There is. So when we look at the avian influenza viruses, they're harbored in reservoir species, and those reservoir species tend to be the ducks and geese and wild waterfowl. And these viruses, whether they're the low pathogenic viruses or the highly pathogenic viruses, they follow the migration patterns of the waterfowl. So there's 4 major flyways across the continent. There's the Pacific Flyway, Central Flyway, Mississippi, and Atlantic Flyways. And when these birds go up to their Arctic grounds in the summer for breeding, those viruses, they kind of mix and match, and then they come back down in the fall during the fall migration.
Isn't that something? Dr. Ryan Wolker, again, state veterinarian. Good information. Thanks for joining us.
Thank you very much, Ted.